We have more for your ears only. I'm David Alpern.
I'm Eddie Robinson with this quote from the news. Way too early to make any judgments. That was Ben Bernanke in what may be his last congressional hearing as Fed chairman, reiterating his plan to continue asset purchase until an economic recovery makes them unnecessary. The stock market finished its fourth consecutive up week, the longest winning streak since May. Now this.
The most frequent pattern is that patients who survived cancers had a lower risk of Alzheimer's disease, so lower than the rest of the population. And cancer treatment, combining either chemo or radiation, decreased Alzheimer's risk by 17 to 23%.
There were mixed messages aplenty out of the annual Alzheimer's Association conference in Boston last week. On one hand were indications that the mind-robbing disease might not increase as quickly as previously predicted based on increasingly aging populations. On the other hand were studies suggesting that the minor memory lapses experts previously disregarded might be warning signs after all.
But few of the studies could match the good news, bad news quality of that presented by geriatric researcher and clinician Dr. Jane Driver of the Boston Veterans Administration Health System, Brigham and Women's Hospital, and the Harvard Medical School, as you heard. The finding was that some cancers and cancer treatments actually reduce the risk of Alzheimer's, and not simply because those involved died anyway and too early for Alzheimer's to appear. To talk more about those findings and their implications, for your ears only, we're pleased to have Dr. Driver on the line now. Welcome to the program.
Thank you.
There were similar findings published recently from a study abroad, but yours had the benefit of significantly larger population for observation for a longer time. How big and for how long?
Well, we use the National Veterans Healthcare System database, and that includes over 5 million veterans, and our study included 3.5 million of those, and we followed them for an average of 5.6 years.
We know cancer is not a democratic disease. Which kinds of cancers were associated with the greatest reduction in Alzheimer's risk?
Well, probably the greatest reduction we saw in some gastrointestinal tumors, including liver, pancreas, and a number of others. But really, there was a wide range of cancers for which we saw this decreased risk, including blood diseases like leukemia and lymphoma, cancers like lung cancer, and kidney cancer, and really the majority of cancer types.
Some forms of cancer were not linked to any Alzheimer's risk reduction, and some even seemed to increase the risk. Which were they?
Yes, notably prostate cancer, the most frequent type of cancer in that population, and melanoma actually had an increased association or a positive association with a history of cancer, meaning that those with cancer had an increased risk of developing Alzheimer's disease. And what those two cancers have in common is that they're very frequently screened for. In other words, we go looking for those types of cancers, in contrast to most of the other types. So the reason the pattern's different there may have something to do with that fact, that people who get screened for cancer are fundamentally different from those who don't in terms of their risk of being detected for having other diseases.
You also note that the reduction was only in risk for Alzheimer's, not other forms of dementia, such as what?
The second most common form of dementia after Alzheimer's would be a vascular dementia, which is caused by multiple strokes over time. And we saw that if we look at all dementias as a group, that there wasn't this protective association. But if we only looked at Alzheimer's, then there was.
It's also been noted that cancer has previously been associated with lower risk of other brain cell diseases.
Yes, it's a very interesting pattern. So diseases such as Parkinson's disease, and we've shown that, an inverse or lower risk of cancer in patients with Parkinson's and vice versa. Also, some people have reported it with Down syndrome, a lower cancer risk, as well as schizophrenia.
Your study reflects association, not actual lab trials. But what factors in the cancer disease process and or treatment do experts suspect may confer Alzheimer's risk reduction?
Well, it's a fascinating question, and I think has gotten a lot of people excited to try to answer it. We know that cancer disease is a disease where cells don't die when they should, and disease like Alzheimer's, cells are dying too early when they shouldn't. It turns out there's a lot of genes that they share in common, a lot of biological pathways. And it seems that if you go too far down the road in one direction, you could get Alzheimer's, and too far down in the other, you could get cancer. If we could figure out, if we could discover the things about being susceptible to cancer that protect you from Alzheimer's, we might be able to discover new therapies for Alzheimer's. In terms of treatment, it's been hypothesized for a long time that certain types of cancer treatment might be helpful in preventing Alzheimer's or treating it, and there's some lab evidence in mice to suggest that that could be the case. Whether our findings are because of the chemotherapy or not, we don't know. Future research will have to confirm them and then figure out exactly how chemotherapy is preventing Alzheimer's, if in fact it is.
It goes well beyond your research, but I wonder how you reacted to some of the other studies reported last week. Lower projections for Alzheimer's growth because successive generations are also healthier as they get older.
Well, I've found that to be some good news, and I hope it creates public awareness that the best thing anyone can do to prevent their risk of future or decrease their future risk of Alzheimer's is take really good care of their health in midlife. That means, taking care of your blood pressure, having a normal cholesterol, exercising your brain. We know that all of those things are extremely important for our brain health. And what the news was telling us is that because people are living a healthier lifestyle, then we as a society can decrease the societal burden of Alzheimer's, and individually we can decrease our own risk.
Dr. Jane Driver is a geriatric researcher, clinician, and educator at the Boston Veterans Administration, Brigham and Women's Hospital, and the Harvard Medical School.
Quote from the news, if some of it is due to a slow metabolism, it would really change the way we think of the disease. That was Dr. Joseph Majzoub, chief of endocrinology at Boston Children's Hospital, on new studies showing that obesity may be genetic. And this, a strong reminder that constitutional standards still apply. The courts have to adapt and law enforcement has to adapt. That was Peter G. Viniero, a former New Jersey Attorney General, on a state Supreme Court ruling that police must get a warrant, a search warrant, before tracking information from cell phone providers.
Next, Viva V-Discs, celebrating music sent to the front in World War II. For your ears only.